Hello, everyone, and welcome to our webinar on safe and sustainable food contact materials in European healthcare. I am Andrea Zatinka, Circular Healthcare Project Officer at Healthcare Without Harm Europe, and today I will be moderating this call. So food contact materials are becoming quite a big issue nowadays because of the health and environmental risks that are associated with many of them. So this is especially the case now with more and more hospitals moving towards disposable items, which are sometimes riskier. So that is why we want through this webinar to encourage a discussion on solutions that are good for both health, so no toxic chemicals leaching to food or drinks, but also for the environment. So ideally, that would be reusable solutions. We will start with an overview on the issues surrounding food contact materials. Then we will have two examples from healthcare on how they decreased the health and environmental risks of food contact materials. And then we will have a Q&A at the end. So if you have any questions, please write them. Our speakers for today are Jane Mjönke, who is Managing Director and Chief Scientific Officer at the Food Packaging Forum, Alexis Percival, Environmental and Sustainability Manager at Yorkshire Ambulance Service NHS Trust, Muriel Toran, who is Hospital Service Agent, and Dominique Licot, Midwives Coordinator, both of them working at Centre Hospitalier Angoulême. Before we hear from our speakers, I will very briefly present who we are. So Healthcare Without Harm Europe is a non-profit network of healthcare institutions, local authorities, and environmental and health organizations. Healthcare Without Harm Global has offices around the world and also regional partners. Our vision is that healthcare mobilizes ethical, economic, and political influence to create an ecologically sustainable, equitable, and healthy world, which is in line with the Hippocratic Oath to first do no harm. And this should, of course, apply to both humans and the planet. And our mission is to transform healthcare so that it reduces its environmental footprint and becomes a leader in the global sustainability movement. We do that across a few program areas. We have climate smart healthcare, where we work on reducing healthcare's climate impact. We have sustainable food, where our focus is on reducing food waste and ensuring that the food served in healthcare facilities is healthy, nutritious, and sustainable. In our Safer Pharma program, we work on reducing the risk of antimicrobial resistance. And lastly, we have circular healthcare, where we focus more on the products used in healthcare and ensuring that they are toxic-free and that their environmental impact is minimized. We also have an international members network with members from 72 countries. It is called the Global Green and Healthy Hospitals. And if you are interested in joining, please get in touch with us, because we would be very happy to have you on board. Through this webinar, we also want to show our support to the Break Free from Plastic, We Choose Reuse campaign. So Break Free from Plastic is a global coalition of NGOs and individuals working on reducing unnecessary plastic use in the world. And we are part of this movement. And the We Choose Reuse campaign is mostly to encourage the introduction of reuse systems in our communities. So if you want to find out more about this, you can check the link in the slides. We do believe that healthcare could do a bit more to facilitate reuse in their facilities, and food contact materials might be an easier place to start with this. So that is it from my part. I will now leave the floor to Jane. I will stop sharing my screen.
Hello, thank you very much. It's a pleasure to be part of this webinar today. So I'm going to talk about the environmental and human health impacts of what we call FCM's food contact materials. So we're all familiar with images like this. Plastic pollution has become a global environmental crisis, and it's starting to really affect the livelihood of people disproportionately in developing countries. And if we look at what the main contributors are to plastic pollution, then as you can see here, many items that are used for food packaging are in the top 10. So these are data from the Ocean Conservancy looking at beach cleanups across the world. So we really need to tackle food packaging made of plastic to deal with the plastic pollution crisis. Now, there are many different kinds of environmental impacts of food packaging. So plastic pollution, I mentioned that, but also, of course, CO2 emissions during production, transport, and use are a big concern. So people, in order to break away from fossil carbon as a feedstock for making plastics, for example, have started proposing bioplastics as an alternative. And then we have environmental impacts related to intensive agriculture for producing this feedstock made from renewable carbon, but also biodiversity loss, soil fertility loss, and so on. The whole issue of waste generation, land use for landfill, chemical pollution from landfill, CO2 emissions if we incinerate waste. What about water use, water that is also necessary for producing the raw materials to make packaging and more. So there's a whole host of different kinds of environmental impacts. There's not only plastic pollution. But then people will say, well, we need food packaging. Why? What about food waste? Food packaging can reduce food waste. And so let's take a quick look at what the actual functions are of food packaging. Why did we actually even start using food packaging? And of course, it is about preventing spoilage, and it is about reducing food waste in that sense. Back in the 19th century, when food packaging really started to become a disruptive new innovation in a way, it did enable this long-term storage where humans then could have foods independently of nature's cycles, harvesting at a certain time of year, and then putting the food into packaging to store it over longer term, keeping the pests out and so on. Now, if we fast forward to the 21st century and we look at what additional functions we request from food packaging, it becomes quite complex. So here in green are sort of the more basic ones. We keep the oxygen out to preserve flavor. We keep the CO2 or the fizz in to preserve the flavor, keep the moisture out, keep the light out, advertise the product. That's an important function of food packaging. And then here in red are sort of the more advanced functionalities: enable convenience, enable retail selling, enable high throughput production, convey information to consumer or the labels, nutrients, and so on, important. Enable the experience. This is a marketing requirement. Enable traceability, especially if you are working with organic food and so on. And then lastly, I want to really stress this last point here: enable the logistics of complex global supply chains. So food packaging today is highly engineered. It's a highly engineered product. It does so much more than prevent food waste. It enables complex globalized business models. Retailers could not work without cheap, single-use, throwaway food packaging. And so when people say, okay, we need packaging to prevent food waste, yes, but actually what they're saying is we need cheap, lightweight, single-use packaging to allow our business models to be profitable. So that's a huge barrier and it's a huge problem. Food packaging is very complicated. So just a quick set of general conclusions on the environmental impacts of food contact materials, food packaging. When we look at environmental impacts, let's not just focus on single issues. Let's not just look at CO2 emission or plastic pollution. There needs to be an integrative assessment looking at all the different aspects. Now, I know it's tempting trying to solve this problem for the whole globe at once, but local situations may be different. In certain areas, we have different types of waste management options. So we need to take those into consideration. We have to look at the availability of water when you're looking at reuse, for example. Then another important point, less is less. So you have the waste hierarchy, and reduce and reuse really should be the main focus when we look at alternatives to throwaway single-use packaging. I guess we will hear a lot more about that today. And then the last point I want to make here is to encourage people to not just think of food packaging and food contact materials in isolation. As we discussed before, food packaging has a function, namely to preserve and store food, make it transportable, make it storable. And so food packaging directly is related to the overarching way that we produce and consume foods. And so I would strongly suggest that a food packaging strategy should be part of that overarching strategy. What kind of food is procured? How is the food processed? How is it served, and so on? That should kind of be integrated with food packaging. Okay, so let's take a quick look at the different types of materials. What is food packaging made of? It's very diverse, actually. We think of plastic bottles maybe, but there already you have at least 3, if not 4 or 5 different kinds of materials. So you can have printing inks, you can have adhesives, you can have paper for a label, and so on. So again, food packaging is complex. Thousands of different chemicals are used to produce food packaging. And some of these chemicals, they migrate from the packaging into the food. What does that mean? So migration is the technical term to describe when chemicals transfer from your food contact material into food. And so I have this illustration here to show that animated. So these little red dots here in this blow up of our food packaging example are small molecules. These are maybe monomers that are used to make plastic polymer. They're additives. There can be impurities, reaction byproducts. They're small molecules. They can transfer out of the packaging into the food, but also depending on what material your bottle is made of, chemicals, small molecules from the outside, like printing inks or adhesives, can transfer into the packaging or even through the packaging into the food. By the same process, you can also get transfer of small molecules that are food ingredients like vitamins or flavors that will transfer from your foodstuff into the bottle. Now, what drives this migration? So there's a couple of basic simple principles. You get higher migration at higher temperature. So heat increases the speed, but also the levels of migration. Then after long contact time, so a longer storage time will increase the migration. You get higher levels after longer time. Then, of course, the chemistry of your food and the chemistry of your food packaging is important. So if you have plastic, for example, which is made from oil, and you put something that's fatty or oily into plastic, you will get migration, higher migration of fat-soluble chemicals from the plastic into the oily food. And that actually maxes out pretty much at 25% fat content already. It's not that you need to have 100% fat like oil. At 25% fat content in your food, you pretty much get the total migration of these fat-soluble chemicals. And then another point here, you get higher migration when you're using small portion sizes. Why? Well, think of a brick of milk or orange juice, like one of these beverage cartons, 1 liter. You have surface area to volume ratio. Now, if you shrink that down to maybe 250 milliliters, you are increasing that ratio. So you get a higher surface area in contact with a smaller volume. And that means that proportionally you get higher migration the smaller your portion size becomes. So what I really want to stress here is that migration happens at low levels. So chemicals transfer from food packaging into food at low levels. And there is kind of an explicit assumption in today's food contact regulation in Europe that low levels are safe levels. But for several important reasons that I'm not going to go into all details right now, low levels cannot be equated with safe levels. Just to give you the highlights, some of the chemicals are active at low levels, but not active at high levels. So these are certain endocrine disrupting chemicals, bisphenol A, I'm sure you've all heard of. Then we're not exposed to one single chemical at a time. We're exposed to mixtures of chemicals at a time. And these mixtures, they can add up. They can have mixture effects, mixture toxicity. So if you have individual individual chemicals that are present at low levels, it still doesn't mean that the mixture doesn't have an effect. And the third point that's important here is that we have sensitive windows of exposure during development and so on, maybe also in patients that are ill, that have certain illnesses, and their low levels of certain chemicals can wreak havoc. Have a look at my video blog on this if you really want to learn more details about that. So now back to our question here. What types of chemicals are actually in food contact materials and how do they affect human and environmental health? So we recently published a study, a database where we compiled all of this information. So there are over 12,000 chemicals, actually 12,285, that we found to be very likely that they're being used to produce food contact materials. So that's food packaging, but it's also the processing equipment, storage containers, and so on, you name it. So it's a big number of different chemicals that are being used. Interestingly, not all of these chemicals that are being used actually have toxicological data, at least publicly available. So about a third of them lack this publicly available toxicity data. And for the ones with available toxicity data, the data are not always relevant. So this is a big knowledge gap here. And we then prioritize those chemicals for which toxicological data are available, for which ones are the most hazardous. And here we selected the chemicals that have some environmental aspects, so aquatic toxicity, or that are very persistent and bioaccumulative, and then also the endocrine disruptors, chemicals that are toxic to reproduction, mutagenic, or carcinogenic. And here we came up with 608 chemicals that we would recommend to the regulator and to industry stakeholders to avoid when they're making food packaging. Now, I just want to finish off by saying that we are dealing right now with two disconnected worlds. Andrea, you said it really well in your introduction. So on the one hand, people are working on driving our current linear economic system to a more circular economy, where we reduce resources, we reduce the loss of energy, we ideally will achieve to decouple economic growth from consumption, because that is really affecting humanity's impact on the environment right now. And part of this approach is also to reuse and less importantly, but also unavoidable, to recycle food packaging. There is no focus right now in this discussion on chemical safety. And I think that's a very significant shortcoming. On the other hand, the world that I usually interact with is the food contact world, where chemical safety is everything. People talk about it all the time. We have disagreements about how to deal with chemical safety. I mentioned the low levels are not safe levels. So there's certainly lots of room for improvement there, but people think about this a lot. And these two worlds are completely disconnected. And so in an attempt to raise awareness for this fact right now, while we're having all these discussions about Green Deal and circular economy, but we're also currently revising the European Food Contact Regulation, we at Food Packaging Forum exactly 1 year ago published the scientific consensus statement that we wrote with 33 scientists from across the world on the impact of food contact chemicals on human health. Why? Because when we recycle and even also reuse certain kinds of materials for food contact, we have to take care that they're not contaminated with known hazardous chemicals. I showed you that chemicals can be absorbed by the packaging as well. So it really matters what materials we are using here. So, and with that, I'd like to conclude. So I showed you that chemicals migrate from packaging into food, mostly at low levels, but that is a fact that's been researched for the last 40 years. That's very established. Low levels of hazardous chemicals are not automatically safe levels, and not all materials are suitable for recycling into food packaging. I also showed you that the environmental assessment of food packaging should integrate different aspects and also importantly focus on local conditions. And I think kind of a general conclusion is that we need to reduce our overall consumption as human society. We need to simplify the materials that we are using, and ideally we will use inert food contact materials which can be reused, which can be easily cleaned, because this will reduce the overall environmental and human health impacts. And so with that, I would like to just leave you with a quick sales pitch for Food Packaging Forum. We're a charity. We work in the interest of protecting public health, and all our products and materials are freely available online. So please go have a look. I just want to highlight this database here that we recently published on different brand and retail initiatives concerning food packaging. So if you're interested in seeing which brands and which retailers are committing to what, then please go and have a look. And sign up for our newsletter, please. It's free. Thank you very much.
Thank you, Jane, for the very interesting presentation. If anyone has any questions to Jane, please write them in the Q&A and we can answer them at the end. Now we will have Dominique and Muriel present. I'm not sure if you want to share your screen or should I do it?
Est-ce que tu as partagé l'écran?
Non, dis-lui qu'elle laisse ça, qu'elle le mette.
Can you do it for us, please?
Okay, sure, don't worry.
Est-ce que tu peux le mettre en diaporama?
Is it okay?
Yes, it's okay. Thank you.
Okay, just tell me when you need me to switch the slides.
Tu diras.
Okay. How do I tell you? I tell you to slide? I will just tell slide, or I make a slide to you, or
as you wish.
Okay. Okay. Hello, everybody. Dominique and I, we are going to talk to you about the plastic, what we have done in the Angoulême Hospital, about removing the plastic in the maternity ward, because reducing exposure of pregnant women and young children to plastic, all the alternatives that we have proposed here. Early childhood and the first 1,000 days. Endocrine disruptors affect pregnant women and their children very strongly through them. This chemical cross the placental barrier and permeate breast milk. The French longitudinal studies since childhood conducted by Public Health France for more. for more than 10 years that use yield clear result. This study, which is based on a subsample of 4,145 mothers included in the health cohort, provide for the first time reliable results at the national level of the impregnation of pregnant women by certain environmental pollutants measured from biological sample collected in maternity wards like the cord blood, urine, hair, and maternal blood. The study shows that the majority of pollutants studied are present in almost all pregnant women, and that food is the main source of exposure. Despite the existence of other sources, especially in indoor and outdoor air, the following diagram produced by the Environmental Health Network based on the result of this study shows the main targets of endocrine disruptor as well as the percentage of pregnant women affected by these substances. The endocrine disruptor are natural or artificial chemicals that disrupt the hormonal functioning of living organs. They have harmful effects on human health and can cause growth disorders, neurological section development, reproductive disorders, as well as the appearance of certain cancers and metabolic disease such as diabetes. This diagram that we just saw before, you can see it everywhere nowadays. The summary of human study of health studies shows that bisphenol A may cause endocrine disruptors in children after exposure in utero, can have hyperactivity, attention deficit, and anxiety. In the adults who's exposed directly, can cause diabetes, hypertension, metabolic syndrome, obesity, arterial disease, and fertility problems. Also, we can find the phthalates that cause disruptors endocrine. In children after exposure in utero, you can find lowering IQ observed at the age of 7, DNBP and DIBP, decrease in anogenital distance in small boys like feminization sign, DEP, BPZP, DNBP, and DIBP, and in adults exposed directly, endometriosis in women affects the fertility, and oxidative stress like mechanisms involved in cancer in particular. The definitions proposed by the World Health Organization is that an endocrine disruptor is a substance or a mixture of substances which alters with the function of the endocrine system and thus induces harmful effects in an intact organism, in its offspring or within subpopulations.
Concentrer sur la diapo suivante. On this picture that we shows you now, that shows the consequences of exposure to endocrine disruptor in humans. It's a sample of a review of the scientist literature in humans in utero direct exposure and health. As we said before, the bisphenol A brings to the children's hyperactivity, deficit, attention, and anxiety, and to the adults, hypertension, diabetes, obesity, arteriopathy, fertility problems. We know that we insist on this because we would like to point that all this plastic that we use and all these chemicals we use in can have big problem on the health of human beings. The phthalates in the child decline the intellectual quotient and feminization of boys, and in adult, oxidative stress, endometriosis for the fertility. At the Angoulême Hospital, we are going to introduce what we did at the maternity ward. The next, on this diagram, you're gonna see like cocktail effect of different substances that you accumulate over the time, which can cause the effect, health effect, like the genetic factor, the stress, the way you are eating, the exposure to a pollutant A, then your age, and the exposure to a pollutant B can go to appearance of the disease. This disease is the fact of multifactorial event. All this put together give all this put together can cause an appearance of disease. It's like a cocktail effect over the time. The action that the maternity of the Angoulême Hospital Center has made in place to reduce the exposure of pregnant women and young children to pollutants are: since 2018, we have changed our food containers for breakfast. Plastic food containers have been removed and replaced with porcelain or glass. Food packaging has been modified from individual to bulk, like the jam and cereals. Fruit juices, two main actions: glass containers and local product. Glass bottle, cardboard bricks, apple juice locally, and reason agriculture. The patients that we have are very satisfied at the moment with the changes we made. We had some women who had their second or third child who saw the difference that we had before, and they are much happier with what we made in place at the hospital. The pictures that we show you is our breakfast lunch before the health crisis. You can see that we have some containers on steel or glass for the jam or for the cutlery, also the porcelain or glasses for the breakfast. The only change, the health crisis in the maternity wards brought us to make some adaptation. So now we have been a room service for the patient, but the containers also is always respectful of the environment and the woman's health. Here, our maternity set, an example for our breakfast at our maternity wards. As you can see, we still have the plastic for the yogurt and butter, which at the moment we have not found the way to put it in glasses, but the yogurt is local product that we're using. Here's some other components that we are using here in our maternity. You can see the bulk cereals or fruit, fresh fruit as well, that we prefer to give to the patients. Also, at the maternity of the Angoulême, here's our lunch tray, which contains mostly glass and porcelain. There are still some plastic containers, as I said before, for the cold starters and the dessert, but we can see the difference to the Poitiers University Hospital Center, which is the maternity who's mostly use plastic food containers and do heat also. It's not just for cold that they're using the plastic, as well for the hot food. The other action, all right, I'm going to pass the next one first, if you don't mind. The other action carried out by maternity with the support of the Regional Health Agency of New Aquitaine are cleaning floors with microfiber and water, control of cosmetic distributed to parents, disinfection of cradle steam incubators, the creation of France's first educational baby room and model to introduce parents and early childhood professionals to Charente, 4 WECF certified animators nesting environmental health workshop for parents since 2018, and 6 in the process of being certified. The involvement of technical services, purchasing department, and the cooking. Our future plan is to switch to a glass baby bottle in June 2001. 4 infant milk laboratory groups are operating in the maternity ward: Blédina, Gigos, Modilac, and Lactalis. We put the Lactalis group forward for June 2021, because they are the only ones to provide milk in mini glass bottles for newborns. We have reduced orders for those who do not have glass bottles. On the other hand, we have switched to organic milk. We have been sorting plastic with the help of parents for several years. Also, we would like to tell you that we received a distinction of the second maternity in France of very high quality environmental health this year, and that we carry on doing all the work to remove the plastic in the pole and in maternity. As we start doing this since 2018, we don't have yet a big feedback for the cost that we made, but we can say that the pregnant woman and the one who has the baby are very happy with the changes we made. And the staff as well that it's working on it is very happy and very, how do I say, very, we have all their support, and also the direction, which is, I'm going to say, young people who are new parents, who have children, and very committed to all these changes, the health of the human being in the hospital, brought us all their support, and are very implicated in all what we are doing here. Thank you very much. Thank you, Andrea, for your help.
Thank you so much. Thank you so much, Muriel and Dominique. It was very, very great to hear about your examples and the work that you're doing there to reduce exposure to endocrine disruptors for this vulnerable group of patients. So it's really great. If any of our attendees have any questions, please don't hesitate to write them in the Q&A. And we will move to our next speaker, who is Alexis Percival.
Good morning, everyone. Let me just share my screen. So, welcome to the UK and our journey on plastic-free healthcare food systems that we've gone through. And thank you very much to both Jane and Dominique for a really fascinating talk. It is alarming how much plastic has affected us and will probably affect many generations going forwards, especially with the likes of BPAs and PFOAs that are embedded in our endocrine system. So I'm the Environmental and Sustainability Manager in the UK, and I was very alarmed when my children were born with the amount of plastic that we consume. So through my work, I looked at exactly what we could do to reduce the amount of plastic, the amount of plastic that we've got in place within the ambulance service, but looking at what is within the health system and everything that we use within our own ambulance service. So to give you a bit of background, the legislation laid down by the EU came into force in the UK last year, and we were looking to reduce the amount of single-use plastic, specifically by 2021, through the Single-Use Plastics Directive. And this is in place for everybody across Europe, and luckily even for the UK as well. So it's banning things like plastic straws, stirrers, plastic cutlery, and polystyrene cups, which can absorb a lot of the plastics that we've got within our systems. But also looking at things like food containers that we need to utilise. We've got a canteen within the ambulance service, and so we needed to have a look at what we could do as well. So the NHS, which is the National Health Service in the UK, used around 600 million disposable cups and millions of pieces of disposable cutlery, single-use clinical items between 2013 and 18. And the Greener NHS, which is committed to reducing the amount of carbon emissions, identified that plastic plays a big role in what we do, but also it's not necessary in many things. So they laid down the Plastic Reduction Pledge, which encouraged NHS organisations to look at what they could do to reduce their plastic consumption. So by 2020, last year, they were looking at no longer purchasing single-use plastic stirrers and straws, and then in line with the legislation set up across Europe, completely phasing out plastic cutlery, polystyrene and oxydegradable plastics. And then to go further beyond that, looking at plastic cups and things by this year. So I wanted to establish what we could do in order to eliminate plastic from our organisation. So I carried out a baseline assessment, and I had a student in to kind of help me through this process as well. So we looked at where we were using plastics, and it's not just within canteen, but across the whole organisation. Then we were looking at things that were the alternatives. What types of plastics are we using? Could they be recycled? Which we found many couldn't be recycled at all because they were so thin. But also looking at the alternatives to plastic products, but also looking at the environmental impact of that plastic versus the alternatives. We also went through the waste process. We have quite a limited biodegradable recycling process within the UK, with only 5 sites that will take biodegradables. So we wanted to assess what the process was and what the process was for recycling, but also where we could look at the alternatives, like looking at a plate versus a plastic plate. We also talked to our suppliers and looked at what alternatives they had. And part of the sustainability program is looking at the cost which is an upstream and downstream, the procurement, the disposal time, the disposal cost, and the staff time for clearing bins. All of this played a major role in looking at what we needed to do within our plastic reduction program. So the easy one within the UK, we use a lot of glass bottles for doorstep deliveries. So we looked at our plastic bottles, of which we were using 8,000 a year, and we replaced them directly with glass. A very simple and easy, quick one. My canteen manager said, well, yeah, I've done that, so what's next? The price was exactly the same, and we basically have a recycling program for these glass bottles that just go back around in the circuit. They're washed, cleaned, and returned to the milkman on the same day. And they come in plastic crates and get returned back to the milkman, who picks them up the following day. Now, cups were a real challenge because the mental attitude of a few years ago was to look at just using a plastic-lined disposable, supposed plastic paper cup. We've only just got a paper cup recycling facility that can separate, as Jane was mentioning, the many layers of containment within that. We've only got one of those in place. So we were looking at alternatives as to what we could do. And so all of these bags around the outside, we were using around 4 bags of paper cups worth a day. And we just thought, well, in fact, what we can do is just encourage people to use their reusable cups. So we implemented and brought in a rent-a-mug scheme, encouraging people to basically use their own mug, or they could rent one, as in kind of borrow it from, so they pay a £1 deposit and they get to keep the mug at the end of it, or they can sell it back, in inverted commas, so they could basically give the mug back and get their £1 deposit back. This worked really, really effectively, and we managed to replace 104,000 cups on an annual basis. I know some of the larger hospitals are using around 2 million cups a year in their Costa Coffee and Starbucks and various other coffee locations. So by encouraging people to use reusables, we instantly diminished the amount of waste that we were generating, the paper cups that were needing to be procured, and the time for people clearing out the bins. Now, plates were a bit more of a challenge because we had, it was considered a canteen. So anybody wanted to come in, they could take their food away from the restaurant and they could use the plastic plates to do so. So because we're a bit of a closed site, we decided to replace them with washable plates. It's very strange because at home people use plates. They don't go and use plastic containers. But having a washable plate, basically anybody could come, take a plate, they could wrap it up, or if they were leaving the site, they could use the paper cardboard box with cutlery, wooden cutlery to dispose of. They're all biodegradable, so it could be put in general waste or compost bins. We also went back to metal cutlery. We had plastic knives and forks beforehand, and we replaced them just with metal versions and wooden knives and forks to take away out of off the site as well. Plastic bottles were a real challenge for us, and I think it's one of those problems within the system, and you see how many are washed up and Coca-Cola being responsible for it. The direct swap is a metal can, which can basically use exactly the same. With the health aspect, it actually reduces the amount of fizzy drinks that people were using as well. We also put in a water refill point and looked for a metal can water supplier as well, of which there wasn't any at the time, but we managed to find one, and he supplied water cans at a reduced price. The water refill points encourage people to bring their own water containers and to refill them in the restaurant as well. Because we moved over to cans, we decided to use a process which we worked with our charitable funds to look at an Every Can Counts facility, and the cans could be recycled within this, and then we could actually send them off and get money back from them for doing so. So it was a win-win for everybody in the system. We also looked at sachets, which we were using many hundreds of thousands of sachets a year for tomato ketchup and vinegar and salt. And apologies for the photograph, but essentially we looked at larger containers, multiple use, and they could be refilled as well. So we use this for salt and sugar and for various other things like tea bags. Vinegar and salt we had on tables, but also could be picked up from the restaurant area as well. The food delivery, we went from having everything delivered in plastic containers to reusable crates, and there were cardboard boxes before, which generated a lot of waste. All of these crates are returned back to the supplier, and we're in the process of working our way through the single-use plastic as part of this supply chain as well. We didn't have much success with the wrappers, with the sandwiches, of which we have a lot, but we had a bar where you could basically buy have a sandwich made up for you by the restaurant staff, and this enabled us to basically eliminate the plastic waste altogether. For those that needed to be wrapped up, we've gone for a bit more substantial plastic or a paper with a small plastic window around it, so we can minimize the amount of plastic. And so that was a bit more of a challenge through the kind of deplasticizing process. Engagement was really important as part of this. So I did an event to look at what we could do to show people that where we use plastic, how we use plastic, and the toxicity of plastic. I got all of the restaurant staff engaged in it, and they were all very keen to kind of help propel it forwards and ensure that the canteen was kind of promoting the reduction in the amount of plastic they had. So we produced lots of different posters, kind of having the information relating to what we were doing, how we were doing it, and why we were doing it. And posters and also signs on the tables explaining everything and how we can kind of move forwards on that. So we set up a plastic-free process within the organisation, and we looked at what we could do to ensure that any new healthcare contracts for food were plastic-free, and also kind of other processes as well through procurement were reducing the amount of plastic as well. It started a lot of conversations with our suppliers and about how we reduce waste and look at the alternatives, but also any plastic we use need to be recyclable. The impacts to the plastic was considered through the procurement and the waste stream, but we found that COVID and coronavirus has increased the amount of plastic waste due to the perceived contamination risk. So we've had a little bit of a step back recently, but it is something that is back on the agenda to ensure that we eliminate more as we go forwards. So one of the big things is having plastic embedded, and it's the big chunk at the bottom. It's about how we can reduce packaging, how we can reduce plastics, but also ensuring that any plastics we have can be recycled wherever they need to be. But ultimately, it plays a major role in our carbon reduction and our human health aspect as well. The direct impact has been that we've reduced around 206,000 items a year from our canteen and our restaurant space. There will be ripple effects up the chain, but also the suppliers have provided plastic-free products to many other people. So we're looking at over a 10-year period, probably about a 2 million piece reduction just from the restaurant alone. It's saved around 200,000 bits of plastic, but it's also saved around £12,000, probably around 14,000 euros a year on procurement and disposal. But also there's been the reduction in waste generated around 4 tonnes, but we had to replace it with alternative products which were recyclable or biodegradable. Thank you very much, and thank you very much for having me today.
Thank you, Alexis. Great to hear about your work there. So we still have a little bit of time for some questions. If you have questions, please don't hesitate to write them still. So maybe we can start with a question for Jane. Are there any national or local policies that you consider are good practices that other countries or local authorities should look at?
Well, that's a tough one. I don't want to single out specific countries, but I'm half German. I grew up in Germany, and Germany actually still has a really good deposit scheme system. And I was shopping across the border. I live in Switzerland, but close to the German border, and I was shopping there the other day at an organic supermarket. And so there's new innovative startups, food businesses that are making use of this established deposit system. So they took the standard size yogurt jar, it's a glass jar, it's returnable, there's a deposit on it, and they're using those jars for nuts, for coffee beans, for tea, and so on. So, you know, kind of because they're sick and tired of not having an option to put these products that we all need into returnable packaging. So I think that's something that I personally would like to see much more of. I voiced this opinion at a packaging industry sustainability conference a couple of years ago, and then people said, yeah, but then we have socialism. If we have standardized packaging, then we have socialism. I don't know, maybe Alexis has something to say on that. I mean, did people complain when you brought back the glass bottle? It's boring, there's no colors on it.
No, I think that's a great idea, and it's part of the circular economy aspect of everything that we need to look at, and reusing products that are glass is even better because it saves that embedded energy from being melted down and starting again.
And speaking of deposit return schemes, I was wondering if, Alexis, you are considering introducing a deposit return scheme, kind of like a rent-a-mug, but for the takeaway containers. And also someone else asked if there were any problems with the rent-a-mug scheme with the coronavirus.
Yeah, I mean, with the coronavirus, we've, well, nationally, there's been a shutdown on people taking their own cups and mugs to coffee shops. But within the UK, we're still in lockdown. So we have quite a few challenges, and a lot of coffee shops aren't open anyway. So, but it has increased dramatically the amount of single-use plastic waste. There is a big push to get that reusables back on the agenda in many places. For us, I think we've shelved it at the moment, but it will be coming back. It is something that it's a necessity, I think, in modern life that we need to look at this. And it's more about protecting the person who's picking up the container than the person that's drinking from the container, because we need to kind of look on both sides as to how to protect people that way, I suppose.
Thank you. And lastly, we have time for one question for Dominique and Muriel. Does having communal containers for jam and bread increase the risk of spreading contagions?
No, actually, we do not have the contaminations because like the jam we use for 2 days and then it's put to the fridge. And since we have the COVID-19 and we served the patients ourselves, the patient do not touch the materials. We are putting them in small containers, glass containers, individual for each room, which doesn't make the contaminations of the food, even for the cereals. Before, when we had the self-service, it was each container had their own spoon to either to take the bread or the jam. The patient wasn't allowed to use their own spoon. We had individual spoon for each thing.
Thank you very much. Well, now it's already 12, so I propose we wrap this up. Thank you to all the speakers for your great examples and also to the participants. I wish you all a great rest of the day.